Welcome to the Genesee Health System Annual Compliance Training. My name is Lisa Shumpert. I'm the Corporate Compliance and Privacy Officer for Genesee Health System. My office is located in the Genesee Health System 420 West 5th Avenue building in room 507. You can reach me on the ethics hotline at 762-5288. If I'm not available to answer your call, please leave a message and I will return your call as soon as possible. Here's a nice overview of the Medicaid program administration for behavioral health services. Each level provides a unique role from 1, the federal standpoint, 2, the state level, 3, the regional, 4, the county, and 5, local contracts. Each play a very valuable role in administering the Medicaid program. Please review this slide. I've added this slide relative to the coronavirus. Genesee Health System and GCHC is offering increased flexibility with respect to telehealth services provided during this COVID-19 public health emergency. Excuse me, this flexibility will enable many of you to continue to provide the much needed and valuable patient care that our consumers and patients need. The Office of Recipients' Rights and Behavioral Health and Developmental Disabilities Administration has a temporarily suspended enforcement of the written consent requirements to ensure that services are not being withheld or limited due to the inability to get a written consent. Staff should make use of alternatives to face-to-face encounters. They can be used to obtain written consent where appropriate. This includes, but is not limited to, fax and email or picture of signed documents sent via text or email. All attempts to obtain written consent to be documented, along with the verbal consent in the recipient's record. When obtaining consumer and patient verbal consent to treat, try to document verbatim in the record. For example, during the time frame of the COVID-19 pandemic, verbal consent was obtained on, and then the date, via communication method you used from the appropriate individual for the service and the type of public-facing remote communication product that you may have used. And the patient has agreed to that, and that you have explained the risk associated with utilizing telehealth. Questions relative to telemedicine may be directed to ITS in the form of a health ticket and/or corporate compliance relative to verbal consent. This slide also is about dealing with consumers and the coronavirus or COVID-19 pandemic. Please be aware that many rules remain, including ethical treatment and the minimum necessary standards of sharing, as well as public unnecessary disclosure rules. So HIPAA is still in place. Please be prudent and professional as you work with consumers and others. It is the expectation of Genesee Health System that all staff exercise a good faith effort in explaining to consumers and patients their rights and risks relative to telehealth, or if you're providing face-to-face services. Consumers should be aware that a data breach or an exposure of protected health information from a telehealth session is possible. However, any bad faith use of telehealth will be subject to enforcement and penalty and may include any criminal act, fraud, identity theft, intentional invasions of privacy, sales of protected health information, or violations of professional ethics standards and compliance standards outside of what is deemed reasonable relative to treatment necessity. It is our expectation that you utilize a practice of service that offers as much privacy as possible in this circumstance. So what is compliance? At GHS, it is important to practice a do-right culture of compliance. C, commit to doing the right thing. Obey the regulations and policies that apply to your job. Make compliance awareness part of your job. Practice using the compliance code of conduct as a guide. And if in doubt, check it out. Attend training sessions, notify supervisors of possible wrongdoings. Communicate openly and honestly. Ethics is part of all activities. So it is important to know that there must be 7 elements present in a successful compliance program. Those elements are listed here for your review. How is your ethics? So the Genesee Health System Compliance Code of Conduct should be reviewed annually and can provide guidance relative to ethics. Here's the policy number. The compliance programs support organizational ethics. What is the role of compliance when it comes to ethics? And then what does that look like? Actual or potential conflicts of interest exist that have no safe harbor and should be evaluated by human resources or compliance. And below, I've provided an example. Please examine all of the examples in the slide. Additionally, it is important to note that the establishment of a safe harbor and evaluation of an issue before engaging in an activity, safe harbors often will guard against conflict of interest. At Genesee Health System and the Genesee Community Health Center, it's important to provide and obtain information regarding outside employment, potential contracts involving close family members, as defined by Genesee Health System standards, policy, and finally, to include or to inform your employer where there may be a potential for conflict of interest. The Deficit Reduction Act of 2005 is a very important law. And in addition to this slide, staff should also complete a self-assessment of those things that the average person would view as misconduct. Don't stick your head in the sand. Investigators look for internal controls, a compliance program or officer and board involvement, a compliance code of conduct or agency plan, patient plans of care, good quality care, medical necessity and progress toward recovery, accurate documentation and best business practices, your training and understanding of healthcare law. Willful ignorance of the law is no excuse for bad behavior. Conflicts of interest, billing problems, credentialing and privileging, corrective action and prevention, agency property, due diligence, and Whistleblowers Act. How the law protects you. You should have no retaliation, no retribution when you report wrongdoing. It's about education, written standards, and creating increased joint oversight between federal and state governments. Laws impacting healthcare. So I'd like you to take a moment and review the slide. This is the Federal False Claims Act. This is a federal statute that covers fraud involving any federally funded contract or program, including the Medicaid program. It establishes civil liabilities for certain acts, and these are included below. So knowingly violating the Federal False Claims Act would including having knowledge of information or your deliberate ignorance or reckless disregard for the falsity of the information. No proof of specific intent to defraud is required. Here are some great examples of what a Federal False Claims Act is all about. This information and additional examples are also located in the Genesee Health System website. Please review this slide as well, Laws Impacting Healthcare, Federal False Claims Act. So here's an example of billing. Consumer Sally B was scheduled for 60 minutes of psychotherapy with Dr. Smith. Sally arrived for an appointment, extremely distraught and in crisis. The receptionist immediately contacted an ambulance. While waiting for the ambulance, Sally never left the waiting room. Dr. Smith interacted with Sally for approximately 5 minutes until the ambulance arrived and transported her to a nearby hospital. Dr. Smith had 60 minutes scheduled for Sally B and was unable to schedule other consumers during the time block. He also saw Sally B, even if it was for 5 minutes. Dr. Smith submitted a claim for Sally B's visit. For 60 minutes of psychotherapy, the claim was paid out of Medicaid. A month later, as part of a routine Medicaid services verification audit, Sally B's claim was selected as part of an audit sample. And when auditors contacted Dr. Smith's office to obtain documentation to support the services billed, he instructed his receptionist, the one who called the ambulance, to create a progress note for 60 minutes of psychotherapy furnished by Sally B on the day she went to the hospital. The receptionist created the note. Dr. Smith signed it and dated it the day Sally B went to the hospital, and the progress note was provided to the auditors to support the services billed. Is there a problem? So I've kind of highlighted the various issues that are in this slide related to the billing. So please review this slide. Medicaid was charged for a claim for 60-minute psychotherapy service when Dr. Smith only saw her for 5 minutes. That appears to be intentional fraud. Dr. Smith instructed the receptionist to create a progress note for 60 minutes for an audit. So documenting a service not provided is intentional fraud. The receptionist created a note and Dr. Smith signed and backdated. The receptionist and doctor intentionally created, signed, and presented a note to auditors to support a service that was not provided but billed. Falsifying documentation for payment, intentional by both the receptionist and the doctor. So this will be a violation of the Deficit Reduction Act. So fraud, waste, and abuse. True fraud is distinguished from the mistakes even in the law. Fraud does not actually begin dishonestly. It begins with pressure and confusion, gray areas, and increases in complexity and scope over a long period and locks in innocent participants. So there's no escape. It usually involves new ideas and good intentions by individuals and organizations. On a very basic level and briefly, I'd like to review false claims, anti-kickback, and Stark laws. These items are also referenced in our Code of Conduct policy for compliance. False claims originally began in 1863. This law seeks to discourage suppliers, us, from overcharging the federal government. It prohibits knowingly and in some cases unknowingly submitting or causing to be submitted a false or fraudulent claim. Billing for services not provided, providing for a service but using the wrong day, billing for a service that was unnecessary, billing for non-covered services, double billing, timesheet falsification, unbundling, inclusive services that is resubmitted as a separate service. It is everyone's responsibility to recognize and combat false claims for your own protection and integrity. And although there is a significant detail in this policy, I would like you to take the opportunity to again give you a brief overview. All entities receiving at least $5 million must establish written policies relative to this act. We must provide you with knowledge and education relative to the State and Federal False Claims Act and review with you your whistleblower rights and protections with respect to preventing, detecting, and deterring fraud, waste, and abuse in federal healthcare programs. In the Federal Civil False Claims Act, a civil action against a healthcare provider may be brought against a provider who knowingly presents or causes to be presented a false or fraudulent claim for payment or approval to a federal employee. Knowingly makes, uses, or causes to be made or used a false record or statement to get a false or fraudulent claim paid, or conspires to defraud the government by getting a false or fraudulent claim allowed or paid. There's also a Michigan Medicaid False Claims Act, and although Michigan had a similar law relative to the federal law for false claims, the Deficit Reduction Act now requires all states to have their own law and may obtain 10% of all monies recovered in a false claim if the government reviews and accepts the conditions of the state law. A false claim action may be brought by the U.S. Department of Justice Civil Division or the Attorney General. An individual can bring a qui tam action suit on behalf of the king. Well, that's basically what that means. And oneself. Violations of the act may bring $5,000 to $11,000 per false claim, or even bring treble or triple the damages, as well as criminal penalties. Whistleblowers' protections prohibit an employer from discriminating against an employee in the terms or conditions of his or her employment because the employee initiated or assisted in a false claims action that was accepted for investigation. What to do if you think you may have made a false claim? Report it immediately to your supervisor or compliance officer or representative. If you do not feel comfortable reporting to your supervisor or compliance officer representative, report instead to the Genesee County CMH Ethics Hotline, which is 762-5288. You may report directly to the Department of Justice, Genesee County CMH, or your employer. And they cannot retaliate against you if you report outside of the agency. Again, you should make every effort to report in good faith, since fraudulent reports of a false claim can incur liability outside of the employer. The major false claims and anti-kickback statutes include False Claims Act, Anti-Kickback Statute, Physician Self-Referral Statute, and Exclusion Statute, Civil Monetary Penalties Law. Please review the slide of the Michigan False Claims Act. Please follow along as I read this slide. There are other laws impacting your provision of healthcare. There's the anti-kickback statute. Healthcare providers and suppliers may not offer, pay, solicit, or receive anything of value in exchange for the referral of patients or services covered by Medicaid, Medicare. Fines can include up to $25,000 per violation and up to 5 years in prison per violation. Providers must ensure that no federal funds are used to pay for any items or services furnished by an individual who is debarred, suspended, or otherwise excluded from participation in any federal health care program. This includes salary, benefits, and services furnished and prescribed or ordered. In terms of the federal law, the federal exclusions are imposed under the Social Security Act. They are mandatory and permissive. Examples of mandatory exclusions are convictions of a crime relating to patient neglect or abuse, felony conviction of healthcare fraud. Examples of permissive exclusions are misdemeanor convictions relating to healthcare fraud, convictions relating to fraud in a non-healthcare program, and examples of mandatory exclusions include conviction of a program-related crime, conviction of relating to patient abuse, and felony conviction related to healthcare fraud, and felony conviction related to controlled substance. Please review this slide with me and understand that those excluded or finding themselves on the exclusion list may not provide services to Medicaid and Medicare beneficiaries. And examples of permissive exclusions are listed below. There are also 2 websites that you can access that also explain this information. Please follow along as I read this slide. This is kind of talking about the civil monetary penalties. And I won't go over every single one, but so you can read along as I just kind of go over the title. There's the civil monetary penalties. There's criminal healthcare fraud statutes. And then there's the Stark Law. So the Stark Law is a U.S. federal law that prohibits physician self-referral. Specifically, a physician may not refer a Medicare or Medicaid patient to an entity providing designated health services. If the physician or an immediate family member of the physician has a financial relationship with the entity, then that also can be a concern. Please review the whistleblower protections that are designed to protect you when you basically blow the whistle on wrongdoers. The Michigan statute also provides protections of employees, and that is also listed here. Most importantly, employers may not discharge, threaten, or otherwise discriminate against an employee regarding the employee's compensations, terms, conditions, location, or privileges of employment. Here are a few laws impacting healthcare. Offering to pay someone to make referrals to your entity or accepting payment for making referrals violates what law? The anti-kickback statute. Placing the employee on a corrective action plan because they reported suspected fraud occurring within the agency would be a violation of this law. The Whistleblowers Protection Act. Using federal funds to pay the salary and benefits of a person who is barred from participating in Medicare and Medicaid would violate this law. Exclusion authorities. Identify that your provider has received an overpayment, but failing to repay the overpayment amount within 60 days of qualifying the amount violates what law? The Federal False Claims Act. And finally, increased federal resources to fight Medicaid fraud, waste, and abuse includes the Deficit Reduction Act. On to fraud, waste, and abuse. Please review the slides entitled Fraud, Waste, and Abuse. Compliance means following the rules. It means you must understand and comply with all the laws and policies that apply to your program. Excuse me. Sorry about that. Compliance means following the rules. It means you must understand and comply with all the rules and policies that apply to your program. Everyone, this includes every employee, board member, administrator, physician, student, and volunteer, as well as those whom you do business with, third-party consultants and contractors, vendors, and many others, have a duty to do the right thing when he or she observes misconduct. The compliance program, Compliance Code of Conduct, gives an overview of the rules that Genesee Health System expects you to follow in various areas. Make sure in your decisions that it is the right thing to do. If you are not sure, check with your supervisor or compliance. If you suspect that someone is doing anything that violates the Compliance Code of Conduct, you must report it to your management, your supervisor, or compliance officer representative. And so in concerning abuse, so we've kind of gone over fraud, waste, and abuse, and you can kind of review this last slide about abuse. Are practices that are inconsistent with sound fiscal business or medical practices and result in unnecessary costs to the payer or reimbursement for services that are not medically necessary or fail to meet professionally recognized standards for healthcare. They can include submitting claims that do not comply with billing guidelines, not providing medically necessary services. I want to caution you that abuse can develop into fraud if there's evidence that the individual knowingly and willfully, on purpose, conducted the abusive practices. And then I provided an example here. Here are a few service document requirements. So Michigan Medicaid, the provider manual requirements, kind of has a list for record keeping. And so the clinical record must be detailed enough for us to reconstruct the kind of services that you build. All documentation must be signed and dated by the person that rendered the services. Documentation, including signatures, must be legible. And if the signature is not legible, the clinician's name and credentials should be printed below. For services that are time-specific according to the procedure code bill, providers must indicate in the medical record the actual begin time and end time of the particular service. Progress notes must include the following: goals and/or objectives of the plan of service addressed, progress or lack thereof toward desired outcome. I'm just going to go over privacy and confidentiality just a little bit. That's also covered by IT concerning behavioral health records. So you can review the information here. We have a couple major governing rules Many of you, well, hopefully all of you have heard of HIPAA and the Michigan Mental Health Code. And in addition to that, the Health Information Technology for Economic and Clinical Health Act, which is HITECH. 42 CFR Part 2 has to do with substance use disorder records. So follow along as I read the substance use disorder record slide. So that would be the 42 CFR Part 2 confidentiality of alcohol, drug abuse, and patient record. Records of the identity, diagnosis, prognosis, or treatment of any patient, which are maintained in connection with the performance of any drug abuse prevention function conducted, regulated, or directly or indirectly assisted by any department or agency of the United States shall, except as provided in Section E, are confidential and to be disclosed only for the purposes and under the circumstances authorized. So essentially, this rule prohibits even knowingly acknowledging an individual as a recipient of services. So we have to be very careful about people who are receiving substance assistance. And it requires a very specific detailed release of information. It requires information that is disclosed to include a prohibition of that disclosure. And then no information regarding a client should be released without a valid signature unless it's related to COVID. And if that occurs, you can give me a call and we'll discuss that. Please review this slide concerning the Mental Health Code because there are other rules that the Mental Health Code has. So HIPAA is the federal law that provides data privacy and security provisions for safeguarding protected health information. It has two main parts, the privacy rule and the security rule. And we kind of go over the HIPAA security rule here. And so you might want to think of it as the electronic portion. And a lot of times if you send the wrong email or, be accessing protected health information on, say, for instance, CHIP, and that's not your consumer. So those are just a few examples, but you can review this slide, looking at the various safeguards that you should take. And then finally, the HITECH Act, which it extends the requirements for business associates. And those are the people that we do business with, and then they have rules that they have to follow when we're working with them in terms of protecting patient records. Mental health records, or HIPAA. So please review this slide as well. It's about behavioral health records, use, disclosure, the minimum necessary standard. We provided some examples here for you. And then also if we're providing information when there is a need to know. So the most common use or disclosure of protected health information is TPO. We're sharing information for treatment, payment, and healthcare operations. HIPAA allows for the use of disclosure of PHI for the purpose of TPO without consumer consent in certain circumstances. However, the Michigan Mental Health Code is more restrictive and allows disclosure of PHI for treatment, payment, and coordination of care without consumer consent. So it's a little different. Coordination of care is more limited for the purposes of disclosing information, more limited than HIPAA. Please follow along as I read this slide. The mental health records, mental health code you should be familiar with is information in the record of the recipient, and other information acquired in the course of providing mental health services to a recipient shall be kept confidential and shall not be open to public inspection. The information may be disclosed outside, may be disclosed outside the department, community mental health services program, licensed facility or contract provider, whichever is the holder of the record, only in the circumstances and under the conditions set forth in this section, which is 748A, which can be found in the Mental Health Code. It was amended April 10, 2017 to allow for disclosure for treatment, payment, and coordination. Best practices: always obtain a valid release of information to ensure compliance with the Michigan Mental Health Code. If you have questions regarding Exceptions to this rule, contact the CMHSP compliance officer, which is me. Changes to the mental health code, please follow along as I read this slide. Treatment, the provision, coordination, and management of healthcare and related services by one or more healthcare providers, including the coordination of management of healthcare by a healthcare provider with a third party, consultation between healthcare providers relating to a patient, or referral of a patient for healthcare from one healthcare provider to another. Payment, activities undertaken by a health plan to obtain premiums or to determine or fulfill its responsibility for coverage and provision of benefits under the health plan. Or A, a healthcare provider or health plan to provide reimbursement for the provision of healthcare. It includes eligibility, coverage determination, COB, adjudication of claims, billing, medical necessity review, utilization review activities, including pre-authorization and concurrent and retrospective review. Coordination of care, not specifically defined by HIPAA or the mental health code. So if PHI is being shared between healthcare providers, it may fall under the purpose of treatment. If PHI is being shared between entities that are not healthcare providers, for example, PIHP, MHP, then disclosure PHI is limited to entities that have current or past relationship with the consumer who is the subject of the PHI, basically the consumer whose record it is. And the PHI must pertain to that relationship. Please contact your Genesee Health System Risk Officer, Tracy Millian, for specific guidance in the area of infectious disorders. I just wanted to share this slide with you concerning HIV and AIDS information. Please review your breach notification policy and procedure for specific guidance in this area. So true or false? Behavioral health providers cannot ever share my records without my permission. False. Protected health information, PHI, cannot be shared by email. This is also false. If GHS receives a request from a provider for patient's most recent treatment plan or mental health only, to assist that provider in appropriately treating the patient, it is acceptable to send the provider the patient's entire record. That is also false. Please review this slide as well. These are the enforcement bodies, and they include the Center for Medicare and Medicaid Services, the Office of the Inspector General, the Office of Civil Rights, the Department of Justice, and the Michigan Attorney General. Finally, the Office of Civil Rights began phase 2 in HIPAA audits in the spring of 2016. 167 cover entities were selected from a larger pool of potential auditees for the desk audit portion of the audits, focusing on compliance with HIPAA's privacy, security, and breach notification rules. And in June 2016, Catholic Healthcare Services of the Archdiocese of Philadelphia agreed to settle potential violations of HIPAA after the theft of a mobile device compromised the PHI of hundreds of nursing home residents. CHCS provided management and information technology services as a business associate to 6 skilled nursing facilities. The total number of individuals affected by the combined breaches was 412. The resolution agreement includes a monetary payment of $650,000 in compliance with a corrective action plan. You'll find here also this case, if you'd like to read it for yourself. And then I believe there are others that are also indicated in that particular link. So I just want to thank you. And And I want you to keep in mind your reporting responsibilities. It is your right and your responsibility to report actual and suspected compliance violations to the Genesee Health System Compliance Officer and or Region 10 Compliance Officer. You may not be intimidated, threatened, or coerced, discriminated against, or subject to other retaliatory action for making a good faith report of an actual or suspected violation. So there's some contact information. Again, thank you, and look forward to talking with some of you.